Good day, everyone. First of all, I would like to thank Miss Joyce Alumno for this kind invitation, and then greet all of you participants of this healthcare leadership development course. I am Dr. Jonas Del Rosario, the coordinator for public affairs of the Philippine General Hospital, and also its spokesperson. If you're wondering why am I here, I'm here to tell you the way that the PGH has handled the pandemic. It has been more than 19 months. But even more so is my personal experience with COVID-19. Uh, Sometime about a year ago, a personal tragedy struck my family. My parents got hospitalized in PGH for severe COVID. And after about 2 weeks of taking care of them, I myself also developed severe COVID-19. At one time, all of us were admitted in the PGH COVID wards. And I have experienced being a patient, being a frontliner, taking care of my sick parents, and eventually the experience of a loved one uh, losing someone very dear to COVID-19. Namatay po ang aking mga magulang. And that experience left a very deep scar. Napakasakit po ng nangyari sa akin. But moving forward, I also learned a lot of lessons in my COVID-19 experience. And because of that, I felt like I am a more credible spokesperson of PGH. Mas naiintindihan ko po ang mga issues na nangyayari sa aming ospital, lalong-lalo na po sa mga pasyente at sa mga frontliners. So again, I'm here to tell you how PGH, the first COVID-19 referral hospital, has handled the pandemic. When the government turned to PGH to be one of the COVID-19 referral center, it was met with a lot of objection. Apakahirap po na desisyon. As you know, PGH is the biggest university hospital of the country. Napakarami po naming pasyente, not only COVID patients, but much more non-COVID patients. We are a tertiary or even a quaternary referral center. We have so many patients. We cater to patients with heart problems, cancer, surgical issues, pediatric and OB complicated cases. So we felt that if we become a COVID referral center, our concern was what will happen to these non-COVID patients. But on the other hand, there was this call. Tumatawag po ang bayan na tulungan ang ating gobyerno. At that time, the Metro Manila private hospitals were overwhelmed. And they thought that PGH is the best place, the best hospital that can become a COVID referral center for a short period of time. So we asked the government to give us at least 2 weeks to prepare and to dedicate 1/3 of the hospital to the COVID-19 operations. It was like getting ready for a war against an invisible foe. Hindi natin alam, napakabago po ng COVID noon. And we really needed to act quickly. So the first thing that we did was to form what we call an incident command team. We call it fondly the PGH COVID Crisis Committee. This was organized right away. I was part of it. Being the spokesperson of PGH, I have to be in tune. I have to know basically the day-to-day operations, issues especially relating to the public and of course to our workforce. This was led by the director, and he handpicked the men and women who will be part of this COVID crisis committee. This committee should be able to cover all areas, especially the critical ones in our operations. And these areas were needed to build a comprehensive war plan that will answer to the demands of this health emergency. If I look at how we organize things, I would say there were about 8 critical areas. The first one is an area involved in clinical operations. That includes the treatment, the assessment, the management of patients. No? So most of the time we employ the heads of the clinical departments to be part of this group. The second one, which is I think is equally very important, was the one in charge of logistics. Equipment and supplies were very important. No? Yung PGH po was a general hospital. We were never like a big time infectious disease facility. So there were so many needs. We needed to make sure that we have enough of them. The third one was something to do with communications. We knew that it is very important to provide the right information. No? There was a pandemic of COVID, but there was equally an issue on infodemic. No? Ang dami pong fake news. And we have to make sure that the lines of communications are there and the credible source of information is established, not only within PGH, but also outside of PGH. Of course, the fourth is someone who's in charge of manpower, doctors, nurses, all types of other support staff, med techs. No? This manpower group will be in charge of taking care of our men, no? All of our needs. And then, of course, aside from equipment, manpower, you have to have the think tank to think of what are the policies or processes that will be involved. And so we tap the ones who are very well versed on this, and we got the help of the experts in infectious disease. No, they know the health infection control issues, and so they are the ones who guided us on how we will keep our patients and our healthcare workers safe. Then we also established what we call the molecular lab. Lab testing at that time was very important. No? There was a time when RT-PCR tests were very limited, but we made sure if we're going to be a COVID referral center, that we can easily test our patients and our healthcare workers. And then when somewhere along the way, when PGH was getting a lot of donations, not just by boxes, but by truckloads. So there was so much positive response from the public. And so we have to decide to put up what we call a donation center, no, separate from the hospital, that will take care of donations. No? Katuwa po dahil may mga nagre-regalo ng pagkain, PPE, kung ano-ano, no? Mga rosaryo. And so we had to have a way of taking care of these donations. Of course, we have to build the PGH and we have to reconstruct it and retrofit it to be an infectious disease facility. So it was a big help to get the engineering part of the University of the Philippines. So we consulted these experts to help us. How can we convert PGH to a very efficient infectious disease specialty with different needs? And then we have safety and security of our patients and staff. So pagod na pagod po ang aming mga security guards. And lastly, we have what we call the Emergency Department Transfer Command Center. Ito po yung parang pinaka-triage wherein we deal with patients coming into the ER or take care of transfers, discharges. So this is actually the first line in command when patients come into PGH. So all of these areas were accounted for, and almost every day we meet, no? Parang halos para kaming isang malaking pamilya, no? We're seeing each other. We're even after the meeting we communicate through Viber chat groups. No? Now I realized that when we were doing this, there were two guiding principles in our preparation. The first one was to make sure that the hospital is well equipped so that we can offer the best possible care for our patients. The second one is to make sure, which is of equal importance, is to ensure the safety and welfare of our healthcare workers. Nag-aalala po kami noon dahil marami po sa aming mga doktor, mga bata pa. These are our trainees, residents, and fellows. Kumbaga sa gera, mga bagito po. And so we are very much concerned. We don't want them to get sick. And just in case they get sick, we make sure that we will be able to take care of them. So for PGH to become a COVID referral center, we basically had to retrofit the hospital. Maraming ginawa, no? Construction left and right. We were given about 10 days to do this. Physical barriers were built to direct the traffic and segregate COVID and non-COVID. We put areas of different zones designated, whether it's a red zone, which means it's really a COVID facility, versus a green zone, which is a non-COVID facility. We bought a lot of equipment. Some were donations, but a lot of them were purchases. New beds, cardiac monitors, ventilators, high flow machines, to name a few, air purifiers of industrial type. Never in my life have I seen parang truckloads of PPEs being brought to PGH. Kahon-kahon po. Dahil every day we almost consume about 600 to 1,000 PPEs because of the magnitude of the operations. We, of course, also needed instruments that can help our doctors. At that time, pag COVID, you want the encounter to be very quick, the procedures to be very precise. You don't want prolonged exposure. So let's say our anesthesiologist requested for a type of laryngoscope that they can easily intubate a patient in seconds, basically, so that they don't get exposed with the aerolization of these secretions. So areas for donning and doffing of PPE were strategically located. Dialysis machines were ordered. The pharmacy had to be reorganized. We made sure the right drugs are available that are meant for COVID patients. Words like remdesivir, tocilizumab, baricitinib, dexamethasone became like a household name in our operations. No, talagang we made sure that we have all of those, and we were lucky because we were a COVID referral center. We were given a priority by the Department of Health to get the drugs that are very needed. Okay. Now, of course, aside from beefing up our hospital's infrastructure and equipment, we had to review our policies, especially hospital infection control policies and procedures. We look at the best practices of other COVID-19 hospitals, both here in the Philippines and in the US and in other parts of the world, and we adopted them. We look at guidelines from DOH, NIH, CDC. You know, during the time of COVID-19, everybody was so afraid to get infected. So minsan po, praning yung mga tao. Konting may makasalubong na baka may COVID, nag-aalala sila, baka sila may COVID na. So we had to put some order. We had to make sure that we are following guidelines through scientific evidence. So we had to place rules on testing. When do you get tested? When are you considered a high-risk patient, or when should you quarantine or isolate yourself? So all of these things have to be put in place. Of course, there were a lot of false news, people claiming treatment, different treatments. Some of the medicines you probably have heard, there are not enough scientific evidence. We have to make sure that we know how to handle this misinformation. Then, of course, most importantly, we realize that it is our men, our healthcare workers, our frontliners, which is the most important resource of PGH. No? We made sure they are well trained. Kumbaga po sa gera, sasabak sila sa gera, kailangang handa sila. So how do we prepare them? We equip them with the knowledge and skills. So lots of training, webinars were conducted. And then, kailangan po may bala. So when we sent them to war, we made sure that the PPE, the personal protective equipment that everybody was wearing, is of international standard. Hindi po kami nagtipid. It was very expensive. Just to give you an idea, ang isa pong PPE was about 1,000 pesos. Yung nakikita nyo po sa mga pictures na parang astronaut ang mga tao, that's about 1,000 pesos. And then you add on the mask, the face shield, the goggles, the gloves, that's around 1,500 pesos for every time you wear it, for 48 hours. And we use about 600 of them. So just imagine, every day, we probably spend about 500,000 pesos just for PPE alone. But we wanted to make sure na hindi po namin sila tinitipid. No? We don't want them to feel that they are going out there and we're just allowing them on their own to get sick. No? So we made sure that was one of the priorities. And then on top of that, we provided housing, transportation, even psychological and spiritual needs. No, we have a lot of healthcare workers who suffered a lot mentally and psychologically. So we knew those concerns and we addressed them. And then when the vaccination came, we made sure that all of our healthcare workers will get their preferred vaccine because we felt that that's the one way of saying thank you to them. And of course, if some of them get sick, and even if their relative, even extended to their relatives, PGH provided hospitalization, free hospitalization for them. Now, communication, both internal and external, is very crucial in our day-to-day operations. Nandito po ako kasama because I was the spokesperson and I was the one in charge of handling the media, providing public advisories if needed. We established what we call the Information and Education Committee, which releases timely infographics, updates, and memos to guide our workforce and even the public. We reach out to the media for important public announcements, and we made use of social media for faster transfer of information. Yung iba po naming mga infographics that was really meant for PGH has been used not only in the Philippines, but sometimes we see them even abroad. The power of social media was really something quite different. And we made sure any infographic that we put out there is well researched. Now, the funny thing about and the reality is in this pandemic is even in your best planning, what you thought was a plan that was well thought of, nothing really was absolutely final. Minsan po may mga palpak kaming mga nagagawa. And so we learned so many things on the fly. We recognize our mistakes and change accordingly to improve our setup, policies, and procedures. And the only way to do this is to discuss the problems that come up daily and look for out-of-the-box solutions. Bawal po mapagod. Kailangan ay maparaan, no? Madiskarte. So over the course of 18 months, we have adapted to these challenging times and made adjustments accordingly. Pangatlong surge na po, no? And this time the Delta surge is really making a beating of so many hospitals, including PGH. Most of the hospitals now are running beyond their capabilities. No, we are operating beyond our full occupancy, and the issues of shortage of manpower, shortage of supplies are now being encountered even in PGH, which is a big COVID referral center. I would like to end my sharing with the 5 lessons that I learned while being on the front lines of one of the biggest COVID referral center in the Philippines. This reflects on how we should handle emergency situations like this pandemic. First, always be guided by science in the crafting of policies and processes. It is the antidote for fear. You won't go wrong most of the time if you base your decision on scientific principles. So we're very particular about the evidence out there. We critically appraise every information that is being put out there. No, so it's not enough that somebody will be vouching for it. Personal endorsements or anecdotal experiences do not count. No. The second is you really need a dedicated crisis team to handle the day-to-day operations, including planning and troubleshooting. It is important to anticipate potential problems because being proactive is much better than being reactive. So being 2 steps ahead will be more advantageous most of the time. The third lesson is teamwork is very important. Sa PGH po may kasabihan kami na nasa iisang bangka lang tayo. Kaya magbayanihan na. The bayanihan spirit talagang very evident in PGH. Not only within the PGH workforce, but the people who have helped us. No? Talagang nagtulong-tulong po mga donors, mga iba-ibang taong hindi namin kilala para ipaalam sa amin na hindi kami nag-iisa. which is a very good Filipino trait. Now, very important is group should be working together, like being connected by one string. No? We should work in unison, not in silos, not independent of each other, because konektado po. Pag may problema sa isang area, konektado po sa iba. The fourth is, again, the most important resource is manpower. So we made sure of their safety and welfare. Infrastructure and equipment are all a must. It is very important that you have a well-equipped hospital with the right equipment, with the right supplies. But without the right people manning the different posts, services will be limited. And lastly, which is, I guess, an important lesson in life anyway, is one has to be adaptable, ready to change direction based on emerging truths. There's no, sabi nga nila, the only constant is change. So be ready to change your plan, to redirect your strategies kung hindi po yun gumagana, hindi nag-work. So constant review, practice, and reevaluation are the keys to successful disaster preparation. So that's all that I can share with you. I hope you can apply some of them. Definitely PGH is right now trying to stay above water. No? We're doing our best to still be one of the COVID referral centers in the country. No? We are running short of manpower, but we're trying our best. We are deploying more people to go to the COVID operations. No? Just like what I told you, balikatan po kami, bayanihan. Sa ngayon po, all hands on deck. Dahil we believe that eventually this too will pass. No? Malalakpasan din po natin itong pandemya. So maraming salamat po.